If you're in midlife and wondering where the hell your desire went or how to get it back and make it hotter than ever, you just found your show. I am Dr. Stacy, clinical sexologist and certified sex coach, and this is the Purple Passion Project, the intimacy and sex podcast for midlife and beyond. Just real, spicy conversations about desire, intimacy, and pleasure that will change the way you think about your sex life forever. Let's do it. Hi there, I'm your host, Stacy, and this is the Purple Passion Project, coming to you live and unfiltered, and the show where we talk sex, intimacy, connection, and everything underneath the surface, because let's be honest, small talk is boring and you're ready for the good stuff. And if you are going through any midlife transitions, this is the place to be, because we talk all about this time of life. So relax, drop your guard, and get ready for truth, laughs, maybe a few gasps, and a whole lot of passion. And so today's guest we have is Scott Stolarick, who is a licensed trauma-informed psychotherapist with 33 years of experience and 26 years specifically working with sex addiction and trauma. So he's a certified clinical trauma professional, the owner of Mosaic Pathway Counseling in Illinois, and someone who uses EMDR to get to the root of what's really driving that compulsive sexual behavior. And I always love talking about EMDR because I know personally I've done some on my own and I can find it very rewarding. We're talking sex addiction, porn addiction, trauma, and why intimacy is so much more than just sex. So here we're going to welcome Scott on the stage here. How are you?
Good. Thank you so much for having me.
There.
Thank you. I'm glad to be here. Thank you.
Yes, absolutely. So I wanted to just open up a little bit about your background so people kind of know who you are, what we're getting into here, and how you actually came to specialize in sex addiction and trauma and that environment.
Yeah. Earlier in my career, one of my first jobs in the profession was working in corrections with inmates in our local county jail here in Lake County. And from there was hired into a position at a nonprofit agency. And that time they specialized in working with sex offenders, sex addiction, and we're kind of the point organization in that treatment in this county. And this was back in 93. So they asked me if I would mind giving that a shot. And I said, I wouldn't mind. At the time, there was a big need for that kind of work and not a lot of people doing it.
Right.
So I signed on and did it for 26 years. And between that work and the work in the correctional facility, I really got exposed to a lot of and people who had unresolved trauma. And the manifestation of that unresolved trauma was harmful to themselves and others. And so really started to develop an interest in how to treat it, and to do so in a humanistic manner and in a very informed consent manner. And at the time, the approach to anyone who was treating sex offenders was just browbeat them. If they're in denial, they're untreatable, and always beat them over the head with what they did. And so it wasn't all that effective. As you can imagine, you don't really engage.
Well, I see that today still. I know somebody's purposely, like specifically, that is or was going through all of that and spent and did their time and then came out, and they keep having them do this and do this and do this. And it's like, you're bad, you're bad, you're bad, you're bad. And it just makes people want to just like scream.
Yeah. And statistically, at least in this county and probably more in the country, people who commit those types of crimes don't serve time inside. A lot of them are given community-based sentences, and the question then becomes, what do we do?
Right.
And many places are not equipped to do it. The training isn't there. So we worked in this county to really develop a model that was balanced between accountability and engagement, and tried to walk that balance between those things. And I found that if I was really tuned in to the individual's trauma history, it made me better at keeping them accountable and more in tune to the person that they hurt.
Right, right. Which is important because they need to be able to feel that and see that.
For sure.
Yeah, yeah. And I know that there's a question that a lot of people have, and especially when they come to me, they say, "Oh, my so and so, my partner has this addiction, that addiction." Is there a difference between obsessive behavior versus the actual addiction? And if there is, what is that difference and how do you figure out what you're dealing with? Because I know many times I will refer out since I don't work with addiction, but how can I really tell? It's like, oh, well, that's just obsessive versus this is addiction.
Yeah, I mean, the way I would look at that is in the area of behavior. There are a lot of people who carry around a lot of ruminating thoughts with them and thoughts that are on a repetitive cycle, but they don't really act upon them in any way, shape, or form because of either fear or they know it's wrong or
Right.
illegal.
So they have the control impulse.
They have that, yes. And there are those who decide to equip that obsessive thought process with action. And then it becomes more of a question of addiction and how much is this manifesting. There are people we had in our program who were attracted to minors for many, many years and did not act upon that until much, much later in life. And so it's, I would distinguish it that way.
Well, it makes sense. So when you're kind of acting upon it, then it's something that you just can't stop yourself. You don't have that stopping mechanism, I guess we were talking about.
Yeah, and I think the other way is if somebody is in a recovery program, let's say, and they know that they've acted out substance, sex, whatever, and they can't do that anymore, or their life will become out of control once again. They may have the thoughts repetitively and realize that they cannot act. So it kind of goes in reverse too.
Got it. Oh, it makes sense. Yeah, because they realize the consequences and they're smart enough or able to stop themselves. When you have someone that comes in, because once again, I work with a lot of people that come in with things such as my husband's, and I say husband just because it's usually the man, the woman's complaining about, I'm addicted to pornography, or the man comes in and says, I'm addicted to porn, or I can't stop seeing escorts or go to get my happy endings at the massage parlor. And so I always like to make sure that when people diagnose themselves like that, they're already pathologizing themselves. And that's one of the first things that can cause issues. And sometimes it may not be an addiction. It may just be what their partner thinks is overwhelming for them in their relationship. So when they come in and see you, like, what is that conversation like? What are you listening for to determine whether there really is something there, or maybe the partner is reading too much into it?
Well, one of the things I look for whenever I do a couples therapy, after the first introduction meeting, I'll break off and ask permission for each to do a social history. So I know more what I'm getting into from a background point of view. But one of the things I look for in that initial meeting is the person who's engaging in that behavior. What is their response when they find out it is not desirable for their partner? That's always very important for me. Is it
like shame or
gee, I don't care, too bad.
Right.
I look for the degree to which intimacy has been communicated in this relationship, oftentimes not at all. I look for whether they've talked about the presenting issue much prior to bringing it to me. And then I go back and do my social history and look at the person who's engaging in this behavior, if there's any impressionable stuff in the background that has happened that we can connect to this. For a lot of, let's say, middle-aged men, there was no talk about sex. There was no sit down and do the birds and the bees. There was nothing like that. It was, it was always the friend's dad who had the magazine. Always, my friend's dad had the magazine.
Look what I found.
And that's sort of the education that a lot of the middle-aged men, or they would discover the dreaded VHS tape. And obviously depictions in those mediums don't necessarily show reality, let's say. They don't depict consent. They don't depict mutual exchange. So many times it will rest in okay, how did you learn this? And how much do you know versus what you don't? And then we take it from there. But a big thing is whether or not they have empathy for their partner's
Right.
objection to what's going on.
Right. They don't necessarily have to agree, but at least having that warmth and compassion and empathy, like you said, that something maybe needs to be discussed or changed or worked on or, understood or just have that conversation. But real quick, before we get back to the show, since we were just talking about no one having a space, I just want to go to my little commercial blurb about something that I've actually just built for the people out there in the community to have a space like that we're talking about. Because when we're younger, we all know, like you mentioned, we don't have that space. So if you are in the midlife life range, did you notice that intimacy and desire may feel different than they used to, maybe more complicated, maybe just confusing? Created a community. It's called Stacy's Vibe Tribe, specifically for this and for a place for people to chat where they could have real conversations about sex, desire, connection, midlife. There's no shame. There's no pretending that it's simple. And honestly, there's a lot of laughter because this midlife is all fucked up. We all want to laugh about it. In this community, there's live sessions with me. There's resources that people could actually use, spaces for both men and women to go deeper with people that are navigating that same exact season of life, because wanting more at this stage is not unrealistic. You just need the right support and right community and people to talk to. So if you're out there listening, come join us. You can go to drstacyfriedman.com. Just click on the community tab at the top of the page. We do offer a week for free so you can see what it's like. So we'd love to see you in there, and we'll get back to the show here. So yes, community is very important, especially when it comes to sex and intimacy, because we don't talk about it enough. And I think that's why so many people have these built up frustrations and built up questions about, am I normal? Right. Is this an addiction? Is this a obsession? What is it? So
there's a lot of questions, and you don't want to overly pathologize, right, but you don't want to minimize either. So it's a tough balance. That's why really gathering your information and really understanding each person's point of view is an important place to start.
Absolutely. And this is like the heart of the episode, where we really want to unpack how things like unresolved childhood trauma, poor sex education, and just even some of that accidental exposure to sexual content can create that foundation for addictive behaviors in adulthood. And you had mentioned when we had spoke prior that 9.5 times out of 10, there's usually something deeper where people have like that jump off point. Yeah. So what exactly does that look like? What kind of things do clients uncover when they actually go back to the beginning?
Wow. So much. I think things that I tend to see are households in which things were very oppressed. You weren't permitted to talk about sex. You weren't permitted to ask questions. It was a taboo topic. Right. And if it was referenced, it was more like in a shame-based manner.
Don't do that. You're too young. You shouldn't be thinking that way.
If a client says they were caught masturbating when they were younger and their parent lectured them about how bad that was, and that it was, however it was phrased, if it was sinful, if it was, you're going to go blind, however, whatever.
The only way you're going to go blind is if you shoot that stuff in your eye and you burn it, but otherwise you should be okay.
Yeah, all the myths, right? So there's that. There's obviously if sexual abuse had occurred, if sex was modeled inappropriately, if boundaries weren't good. But a lot of the time what you see is younger people, especially now, turning to pornography for their, quote, education. And it's not something that really sets a realistic frame. And having worked with juveniles in the court system for many years, that's what they thought would be appealing to a girl, is if they did certain things, and they ended up getting arrested and getting in trouble.
You're doing things, especially when we were younger, because I remember going into my parents' closet, like, what's this videotape? What is this magazine? I remember seeing that stuff. So you're seeing VHS tapes, the Playboy magazines, stumbling onto a parent's video, and you're like, oh, okay, what is that? I mean, that exposure set someone up for struggles for sure. And especially if you're not having the conversations with your parents, then you're not sure what to do with that. And you think, oh, well, this is what it's supposed to be. I mean, it's hidden, it's private. Maybe this is the right thing to do.
Yeah, yeah. It's that coupled with absolutely no healthy dialogue or
Right.
education, it just leaves one to their own devices. And if you're young and immature and your curiosity is driving you, that's not necessarily the educational blueprint that you're looking for. And in more extreme cases, these things morph into behaviors that can cause a lot of trouble, either in relationships and or in society in general.
Right, right. Are people looking for like an emotional connection? Are they looking for something that was taken from them that they were missing? Or is it just not knowing when people are acting out? What are they looking for?
Yeah, I think all of those things you mentioned. If I'm to generically think of a few couples that I've treated, I'll give you an example of the man and woman get married out of college. The girlfriend, the soon to be spouse, is the first partner that person ever had. The female in the relationship has had prior partners. It's an injury for the man in the relationship.
Right.
So there's this desire to become more in control sexually, either through demonstrating what they feel is their prowess, wanting to have that happen all the time, putting pressure on their spouse to divulge what their prior sex life was like, vilifying their partner,
Slut shaming.
that kind of thing. And
Yeah.
or we're not having this enough, so therefore what's a guy to do other than to turn to this to do? So that's just an example of things that I see quite a bit. But the harmful thing is one person ends up feeling inadequate or vilified or you name it due to this just lack of transparency, lack of
Right.
communication, lack of discussion. And it really goes downhill.
Right. And then people start feeling shame because they either don't feel what they're doing is right, but they don't know how to stop it, or they have been talked down to. And is that part of the actual addiction cycle to be able to be feeling that shame?
So if you were to look at it from an addiction model, like substance abuse, perhaps, or the sex offender program that we had an offense cycle.
Hmm.
And what would happen towards, if you can envision like 3/4 of the way through the circle, there would be this reconstitution or this transitory guilt type phase that would occur, in which, and when I say transitory, it's intense, it's short-lived. And the reason is because it's not adaptive. Someone can't carry that a long period of time without coming up with distortions to temper it down so that they can go back through the cycle again. So shame and guilt, if we were looking at it through the lens of a cycle, I would say come more towards that cycle reaching its start point again, and it being a very short-lived experience as well.
Right, right. Yeah, it's a lot because I know that some people, when they realize either what they're doing or how they're feeling, shame can affect not only the person that's dealing with it, but the person that's in the relationship with them, because they're not really sure what direction things are going. Is it their fault? Is it their fault?
I have had many clients who are either separated or divorced, mostly women, who, when they discovered the use of all this pornography, were kind of emotionally hijacked in terms of, okay, now I have to be available sexually at all times because either it wasn't adequate enough for my partner, or if
Right.
I don't, then he
Then
will
they'll leave
bail
me or
out.
do this.
Yeah, yeah. And it's just a real catch-22 place for people who don't know what to do.
Right. And another thing is that there are so many, listen, I'm not here to say whether porn is good or whether it's bad. That's personal. I think
Mhm,
that it can be beneficial for some people, and for some people, it can be damaging. So I think it just depends on the person.
mhm.
But that's where, right away, there's so many clients that I work with that are so quick to judge their partner when they're watching
Oh,
And
yeah.
then they put it on themselves and saying, well, I'm not good enough. I'm not this. They don't find me attractive, all this kind of stuff, and don't necessarily understand. First of all, I mean, if you're doing it in a way that is healthy with your partner, men are more visual. So it would explain why maybe that kind of desire would be more for men sometimes than women. Not saying women don't watch it if they want to watch it, but I see that there's so much of a discrepancy between the two, and the women are always mad at the men for watching, and every man is like, well, every man watches it, and it's like this thing that goes back and forth.
Well, I think the stage for that kind of thing is set when there's a decision to try to keep it secret.
Yeah, or
Because oftentimes, if you look at abuse dynamics, abuse thrives in secrecy. And I think if someone has in their mind that, oh, gee, I want to start watching pornography and I'm bad if I do it, so I
so
can't.
they'll do it in secret.
I can't make it known. And then when it's discovered, it's usually met with anger and frustration. So I think the lack of addressing it in its infancy is what creates problems later. And most of the time when I have a couple in front of me, I mean, it's often she says, well, when he was sleeping, I got into his phone and looked around, and
I've heard that many a times.
Oh, yeah. So that's typically how it shows up on my doorstep, so to speak. And it's devastating because the message is to the partner is you're not good enough, you're not pretty enough, you're not open enough. So it's very damaging. And if it's talked about early on, which practically never happens, I think the ramifications could be different.
Yeah,
Could be
it's
different.
definitely conversation that maybe when you're dating or when, the beginning of your relationship, or even just saying, what do you think about it? How do you feel about it? How does it make you feel? Because I feel sometimes when people are reacting to it, they're also reacting to the insecurities that they have themselves. And for people who are not insecure, like let's say for me, if I find my husband watching porn, whatever, because we have a good relationship, we have good intimacy, if he wants to watch one, so it doesn't bother me. But for some people, their relationship might be suffering, or they have their own insecurities, and sometimes that can cause an issue. But I wanted to just take another quick little break and just talk a little bit about what I do for helping people when they have communication issues as well. And there's a lot of people that have issues having conversations. They've either lost their desire, difficulty connecting, sex has become painful in midlife, or maybe they and their partner have slowly turned into roommates. Erectile dysfunction can happen in this stage of life, and maybe they've just stopped trying because of all these issues, or they look in the mirror and barely recognize their own body. So if this sounds familiar, this is exactly the type of people I work with. If you need any help with the addiction aspect, you can work with Scott, and my coaching programs give you real skills, real support to help reclaim your pleasure, reconnect with your body, reignite the passion in your relationship. And whether you come in on your own or with a partner, I would love to be able to work with you. So you could find me at drstacyfriedman.com and click on the services tab to see how we can work together. And let's get back to seeing some of Scott's specialties with the EMDR, which I'm excited to talk about. So the EMDR approach, it's a highly informed, consent-based approach. And you were mentioning when we spoke earlier about using a light bar and how it prioritizes stabilization before processing. So for some people who don't know what EMDR is, you can maybe explain it in plain language and what actually happens in a session. Because I remember when I was trying to go through it with the trauma I was dealing with, I had no idea what people were trying to explain to me. And they're like, oh, you just go like this with your fingers and you're good to go. So give people an idea what EMDR is.
Well, EMDR operates under the premise of bilateral brain stimulation. So if you look at, in bilateral meaning your eyes moving back and forth, having tactile stimulation bouncing back from one hand to the next, or audio from one ear to the next. That's the bilateral component. The idea is that more mundane or unstuck experiences that we go through each and every day filter through our brain without much significance, without much attention, without much jolt, if you will. But traumatic experiences, when we recall them, are like driving your car over a deep pothole or hitting a nerve, or
those triggers.
yeah, jolting triggers. And those are considered to be undone or unprocessed or knotted or whatever we want to call it. So EMDR at its targets those things and has a person engage in bilateral stimulation when they intentionally bring up the target and eventually get to a place where they're pairing more of an adaptive response to the trauma versus a bolt and a negative response. The idea is to not forget about what happened. You will never forget about it, but it's to know that it's there, to honor and respect its existence, but to not allow it to impede your life moving forward.
So with the people that have the addictions or the traumas or obsessions, if it's stemming from something that could be triggering them, this could definitely help.
Well, certainly could. Yeah. And it's, as we talked about, EMDR is not your traditional psychotherapy paradigm. Right. The therapist, in fact, says very little during that session. So what I want to do when someone comes in and asks me about doing EMDR, I want to spend time in the informed consent space. I give them literature to read, videos to watch, and I desensitize them to the equipment. I let them touch it, press the buttons, listen to it, all of the above. And we talk about things that could happen during the process, abreactions, as we call them, and how those can come about. Mm-hmm. And if a person signs on the line and says, I'm good to go, I have to feel pretty confident that I've covered everything with them. Because as you noted, when I first got trained with this back in, I think, 2004, the trainer who trained us was wonderful, brilliant. Right. Clinician, but what he did that didn't gel with me and my personality is session one, it was like, hey, quick, how are you? What's going on? What do you want to focus on? Let's follow these fingers.
Well, that's what, right. When we spoke earlier, that's exactly what happened with me when I sat down for my very first one. It says, well, what do you want to work on? I said, well, I'm dealing with this. Okay, well, what I'm going to do is you're going to follow my finger and you're going to tell me what you're thinking. So she would do this, follow my finger and says, okay, what are you thinking now? I'm like, what am I supposed to be thinking? I don't know what I'm doing here.
And that's a great point, because I'm often asked, even after I explain it in a lot of detail, if we pause between sets, someone will say, am I doing this right?
Right.
And what we say when we're setting the process up is there are no supposed to's in EMDR. So don't get caught up in, because clients want to be compliant.
Well, you want to do the work. You want to succeed.
Yeah. Yeah. And so the other side of this is clinicians have to get out of their own way too. When I first started EMDR, literally within the first session, I had a client in a fetal position on my couch. And I'm not shy to say that I was in a bit of a panic going, oh my gosh, what
did I do?
What am I supposed to do now? Because it happened so quickly. And so I think that is intimidating to clinicians who are new to this work, because they're used to more of a dialogue-driven session,
right.
process oriented. And when somebody goes right into the trauma, it's a different ball game. And
right, it can be a little overwhelming
for both clinician and
right.
and client. So the clinicians have to be ready too. And I think that worry about, okay, am I going to open something up and hurt this person? And oh my gosh, you're not putting anything that isn't already there. You're just opening a door. And if you want to help them cope, there are relaxation and guided imagery protocol built into the process. So there's a lot of safety mechanisms you can grab onto.
Right.
But EMDR is new, comparatively speaking. It was discovered, so to speak, in 1987. So compared to a lot of other models, it's not that old, but interestingly enough, it's very heavily researched.
Yeah.
And there's a lot of efficacy behind its treatment when done properly.
Right. Well, after the first time I did it, I was just like, this is stupid. I'm never doing this again. And then when I had the right person that I found support me. The transition was incredible. And I remember like saying, well, when am I going to feel better? And she was just like, it's just going to almost just click where one minute you're going to realize you're not getting triggered anymore. And it's pretty much exactly what happened. Is I just remember every single day. And this was the death of my mom, which really hit me so hard. And there was other traumas involved in that. And so I remember sitting there going through it. And sometimes I normally don't cry much. And it like would well up while I was in session. I was kind of like, oh God, what is this going on? But even I was looking back and forth and I was like, I don't understand how this is going to work. And then all of a sudden one day I saw something that normally would trigger me. And it was probably about maybe 3 or 4 months later. And I was like, oh my God, I didn't cry.
Yeah.
Wow. It just was like, boop, really, really neat. Really neat.
If you envision sort of painfully yet patiently untying a very large knot, that's kind of what it's like. And then one day it all loosens and you're able to straighten it out again. That's an image of what I would say that's like. And the processing actually still occurs when you leave. It doesn't stop.
That's what she said. Yep.
When you leave the session, it will continue. It'll either continue in your waking and or sleeping states. And that's good. And that's good because you're doing the work. And just make sure if you feel like you're processing and operating heavy equipment at the same time, you might want to take a break and not put yourself in a hazardous situation, but the work continues. It really does.
Right. And I think that a lot of the issues, like you said, that people have gone through or are going through that cause a lot of these addictive situations need to be looked at from the beginning and be able to find a way to support that. So I think that's really great. And I want to talk a little bit about some of the misconceptions that we have about sex and intimacy. And one of the things that you had said you were looking at wanting to challenge is that the idea that intimacy equals sex.
Yeah, exactly.
And a lot of times I think that I see a lot of people that have had a lot of trauma or things like that have a difficult time separating it because the emotion can't always be connected when you've had, let's say, sexual abuse or trauma. So I want to talk a little bit about that. What does that actually mean?
Yeah, intimacy is a very large category with a lot of things that can actually apply to it, to the lay person, the lay male person mostly.
I was going to say male or women.
It's intimacy is sex.
Right.
That's what intimacy is. We're going to be intimate tonight. That means intercourse. Well,
it's one of the questions I ask all my clients when I first start with them. I was like, what is your version of intimacy and what is yours? And I always ask the male first because the woman always comes up with something totally different.
Very different. Yeah. And intimacy can involve being tuned into how each other's day went that day, being curious. Intimacy can mean remembering something that's important. Oh, you had that meeting today. How did it go? It could be providing encouragement, providing empathy, sharing time. Yeah, sharing time together, reading the same book, being on the same page with parenting, being vulnerable, modeling frustration tolerance, cuddling, touching, caress, kiss. It doesn't have to mean full-on intercourse.
Yeah, and a lot of people need to learn that. And that's actually one of the, I have a lesson that I put in my Vibe Tribe, that community, really all about what is intimacy and what is sex. And I think that when people have had trauma, especially, they're not sure what the difference is, because I was working with a woman who never had good sex because she was abused when she was younger, until she realized, you know what, I'm allowed to have pleasure. This is supposed to be fun. This is supposed to be enjoyable, and had to revamp the whole idea of what is intimacy and what is sex.
Absolutely. And oftentimes, depending on the abuse scenario, if there's grooming that occurs by an offender, that can look like intimacy. You know, that could be like, hey, I'm going to buy you this candy.
Right. You think it's heart-centered. You think it's nice.
Sure. I'm going to buy you a toy, or I'm going to do something good for you. And then as part of that, something happens that feels very, very incongruent. Like, why is this older person doing this to me? Is this, I guess I have to participate because they've been so nice to me. And so it's really puts your mind in a blender. and makes everything upside down and sideways and inside out. And it's a transactional thing. It's something for another person.
Rather than for yourself.
It's not for you. And so, yeah, if somebody's abused sexually in the past, that has to be really taken into account and worked with, because if that person isn't safe in that space, it's just going to be a replication in a way.
Right. Because there's a lot of people that I work with that look to having sex as a way to get love, because that's what they learn. If I want a parent or this person that had groomed me, if I want them to love me, I have to have sex. So they grow up in relationships having sex for the other person so they can get the love that they feel they deserve or that they need, and then never allowing themselves to just take the sex. Rather, they're always giving it and not allowing themselves to enjoy it. So
you talk about, you see promiscuity sometimes being a symptom of somebody who has unresolved trauma or sexual abuse. And I'm often asked, well, if they were abused, why do they do so much sexually? That doesn't make
that they didn't want in the first place.
Right. And the answer that I provide is, well, it's a maladaptive way of controlling sex versus sex controlling them. They choose
giving it versus someone taking it.
Sure. They are in charge. They choose the when, whys, and the hows, and it becomes this process that they are now in their mind in control over.
Right.
So just a lot of tentacles can come off of that abuse situation.
Absolutely. So if you are a partner of someone struggling with sex addiction or abuse, or you are the person that they're listening right now, and I'm sure that if they haven't shared it with somebody, I'm sure they feel alone and not really sure what to do. So what is something like one of the first steps that you would tell them? Would it be to reach out to someone like you, or what would be the first step? Having a conversation with their partner? Where would they be at?
If comfort level allows for it, certainly the discussion with the partner, the entry into a therapeutic space together. Maybe there's online literature, there are online measures that you can take to say, gee, am I a sex addict? Let me take this measure. Patrick Carnes does great work in the area of sexual addiction, has written many, many books. Out of the Shadows is probably his classic one. I would encourage someone who's questioning to educate themselves, either individually or collaboratively with a partner and a therapist. But I think in choosing a therapist, you have to make sure you're going to somebody who can go there with you.
Right.
If somebody's not equipped to deal with that particular issue, that may be more harmful than helpful.
Right. I was going to say, speaking of, I want to make sure I put your information on the screen here too. So that way, if anyone does want to reach out, you're at mosaicpathwaycounseling.org. If they're not watching, it'll be in the show notes. But also one other question is that a lot of times people will come to me and say, I think sorry, husbands, I have to it's usually coming from the wife. But they're usually like, I think my husband's a porn addict. I think my husband's a sex addict. They're already pathologizing them. They're already making them feel potentially shameful. And so they don't really know. And I always tell them to come from a place of, like we use the word curiosity, to be able to have a conversation, to not put blame, to not saying you're doing this, but how best would a partner say, like if someone says, I want to talk to my partner because I feel like they are an addict, or I feel like they are watching porn too much, how would you recommend them approaching their partner?
I think with them having kind of a good working knowledge of who their partner is and what they respond to, I would encourage them to frame it in a way that their partner best responds to. Like, if couples tend to talk at the end of the night before they go to sleep at night, or if they tend to chat after the kids go to bed, or chat while they're doing something together, or just pick a time where you feel the door is most open, and approach it from I'm seeking guidance. Can you help me?
Rather than saying you're doing this and you're making me upset, and because they could be defensive right after that.
Yeah, I'm seeking information, and I want some guidance about this, and I'm hoping you can help me with it.
Yeah.
And the response to that tends to be pretty important. If it's open and embracing, that's great. If it's defensive and shut down and anger, it's all diagnostic, right?
Yeah.
I think
Yeah.
you can gauge a lot from the response. And I think what happens from there usually will follow that same
Right.
thing.
Absolutely. Well, I want people to find out a little bit where they can find you. I showed the mosaic, the counseling there. And do they just go there, contact you? Is there an email there as well?
Yeah, everything you need is on that
On that
website.
page?
It talks about me personally. It talks about my approach, kind of me away from the office, some of the things I like to do, my
And this is
creative.
all in Illinois, you said, correct?
Northern Illinois, yep,
Okay.
Gurnee, Illinois, on the border of Wisconsin, actually. So yeah, the website is the ideal resource.
Okay, perfect, perfect. Before we go, I always like to give everybody a little permission slip at the end of the episode to be able to have an action plan or something that we get out of the episode. And so I want to give people permission to stop reducing yourself or someone that you love to just their behavior when it comes to addiction or trauma. And Scott had reminded us that, what looks like an addiction is almost always something that is much deeper trying to get met, some old pain or unprocessed moments. And so things that happened way before you even met them. So the permission slip is to look underneath all of that, to ask why with curiosity instead of just stopping at what they're doing, and get curious instead of being ashamed or putting shame on someone else. So the action step this week for everybody, have an honest conversation with yourself, with a partner, with a professional about something you're avoiding. And you don't have to fix it all at once. You just have to start. You're enough.
Absolutely.
So,
Absolutely.
Scott, I can't thank you enough for coming on the Purple Passion Project today. And you brought a lot of clarity and wisdom on a topic that so many people are carrying in silence. And so it's really good work that you're doing. And I think it's very important. And for those of you thinking of the EMDR and you are in the Illinois area, it can definitely be life-changing.
Thank you, Dr.
Yes.
Stacey. It's been a pleasure to be on the show today.
Absolutely. We'll see you guys next time. And that is it for this episode of the Purple Passion Project, where we keep it real with just the right amount of spice. If today stirred something in you, let it. And if you loved what you heard, subscribe on your favorite podcast platform and on my YouTube at Dr. Stacey Friedman. And if you're ready to go deeper, follow me all over social media at Dr. Stacey Friedman for resources, tips, place to find fun adult products, or just personal support. And don't forget about the Vibe Tribe. If you go to my website at the community, we could talk about this all day long. So until next time, stay curious, stay turned on, and never apologize for wanting more. We'll see you next time.
This has been the Purple Passion Project with host Dr. Stacey Friedman. Tune in each week as Dr. Stacey breaks down walls, busting myths, and gives you permission to want more with no shame, no filters, and definitely no small talk. Check in every Monday, 7 p.m. Eastern, on your favorite streaming platforms. We look forward to seeing you next time. Be sure to visit drstaceyfriedman.com to learn more.